And thank you for joining us today. Welcome to this PHA live webinar using tele-rehabilitation to reduce fear and anxiety around exercise. We are so happy to have you join us today. Before we get started, I would like to note that this webinar is available in both English and Spanish, so please follow the instructions on your screen to select your language of choice. I'll give you a second or so to select your language. Immediately following this presentation, we will offer Q&A from the audience, so please feel free to submit your questions using the Q&A button on your toolbar to our panelists. Additionally, we would like to take a moment to thank our sponsor, Johnson & Johnson, for their support of this programming, as well as our sponsor, Merck, for their support. Please note that sponsors do not participate in the development of program content or endorse it. PHA is proud to offer professional and patient memberships. Professional members gain access to online medical education, can connect with other professionals, and are able to apply for research grants we have available. Patients can also join the largest organization focused on raising PH awareness and empowering patients. Consider joining PHA today. We will share more information on how you can become a member in the chat. Lastly, I'm sorry about that. The Pulmonary Hypertension Association is committed to advancing research that improves the lives of people with PH through innovative funding opportunities, early career support, and collaborative partnerships, including our Open Partner Award with the American Thoracic Society. We also have upcoming letters of intent opening soon for both the Pediatric PH Research Award and the Health Access and Outcomes Research Award, continuing our investment across PH research and across the PH research spectrum. PHA is also proud to recognize the scientists and clinicians advancing PH research through PHA-funded awards. Their work reflects PHA's commitment to accelerating progress and improving outcomes for the entire PH community, which is why we are here today. I am so happy and proud to introduce Dr. Aimee Layton, who is our 2024 Pediatric Research Award grantee, and her colleague, Dr. Michael Fremed. I'll give them a moment to further introduce themselves in the study that PHA has supported.
Thank you so much for having us here today, and we're really excited to be able to talk to you about some of our work. So I'm going to pull up my slides now for you all. Sorry. I forgot to share my screen. Here we go. Okay, so thank you very much for the lovely introduction. Dr. Fremed and I work with an incredible team of exercise physiologists who helped us to carry out the project that I'm going to present the results of today. I'd like to introduce you to Ruskin Del Mundo. He helped me design and apply the program and work with all of our patients. Erin McCone, she also does all the exercise testing for the study and also helped to organize the sessions and run the sessions. And Quinn Aceto, who also helps to run all the sessions and now is kind of taken over the program as we move it from a research program to a clinical program. So just wanted to give special thanks to the team that Dr. Fremed and I are really appreciative of and all their contributions and hard work into helping patients with PH. So I want to describe the program that we were able to conduct for you all. This was a virtual cardiopulmonary rehabilitation program, meaning that the patients all were able to perform exercise through a Zoom or Microsoft Teams platform. So all the exercise that they did was virtual. They were doing it from home, and we were able to lead the sessions with them without them having to come into the medical center, which is a fairly novel approach for administering cardiac or pulmonary rehab to patients with pulmonary hypertension. Usually they're in-person based programs. To be able to do this safely, we generated personalized exercise prescriptions using the patient's heart rates that we found from their cardiopulmonary exercise test. So each of the patients came in, they did one of those stress tests with the crazy face masks or mouthpieces that some of you may have done before, where we measure your oxygen and your carbon dioxide. And from that, we were able to generate a personalized exercise prescription with heart rate zones that were specific to exactly what they could do. So instead of estimating or guessing, we knew, okay, for this individual, their heart rate zone is going to be, I'm going to make it up, 120 to 130 that we want them exercising in, where we know that they're safe, but also getting effective exercise. Once a week, the patients would work with a one-on-one with an exercise physiologist or physical therapist in the very beginning, and then have to exercise independently the other days. But as we were able to get grant funding, like from the PHA, and be able to expand the program to more patients, we were able to move to a group setting where patients were able to log on and work actually 2 or more days a week with an exercise physiologist or physical therapist in a group. And we'll talk a little bit about those results in the future slides. Each session lasted about 45 minutes to an hour, so the patients would be able to log on. They would start with some stretching and some strengthening exercises. Then we gave them stationary bikes, which we shipped to their home, and they would be able to work out on the bike, and then they would continue with some stretching and strengthening. And it was we had education kind of sprinkled in throughout the entire session, where we could talk to the patients about how they were doing, any of the issues they were having, and also just general life advice as far as like coping with PH. We gave every patient a portable ECG, electrocardiogram. It was just a strap that would go on their chest that they could take on and off for each session, and it would create a PDF of a single lead ECG. So it just gave us a rough estimation of what was going on with their heart while they exercised, so we could help keep tabs on them. We also, as I said, gave them a stationary bike that we'd send to their home if they needed it, some free weights, and some exercise bands. And this is what it would look like for the patients, just to give you an idea of kind of how they were exercising. So this is one of our exercise physiologists, Ruskin, on the screen. And then these are some of the patients that participated in the program, all kind of exercising together with Ruskin. So the results of our study were really positive. We had significant improvements in the patient's 6-minute walk distances and their peak exercise time from their cardiopulmonary exercise test from their CPET. So we had control patients that didn't get the program, and then we had patients that were participating in the program. And so compared to the patients, and this was totally randomly assigned. So patients would sign up, and we just have a special software that said this person will be a control and this one will be a participant. So that way there wasn't anything we call bias with selecting who would be in each group. And because we wanted to give as many participants as possible the opportunity to join the program, any of the controls who were randomized to that group, once they were controlled for 3 months, they could come back and do and join the program afterwards. So what you see here is that the program was really effective in improving patients' exercise tolerance, their endurance, where the controls essentially stay totally stable. A 9-meter change in a 6-minute walk distance is not a lot, and essentially no different time in their exercise test, where the patients in the pulmonary cardiac tele-rehab group, which is that PCTR, they improved their 6-minute walk distance by 35 meters, which is a pretty big increase, and improved their exercise time by about 40 seconds. So the biggest gains were actually seen in their 6-minute walk results. And these were statistically significant. That's what the little asterisk is. So it's not just clinically significant, but they're also statistically significant. Then down to our other outcomes that are kind of the theme of this talk today. We measured anxiety with exercise, which is that ESQ questionnaire. So we also call it like fear with exercise. So fear or anxiety with exercise. Depression scores, so any symptoms of depression, anxiety, which is the ASI, and then general quality of life. And what was really interesting is in these findings, what you can see in the below graphs is there were some pretty dramatic improvements in our pulmonary rehab group, our cardiopulmonary rehab group, which is the blue line. And the orange line are the control groups. So you can see in the exercise-associated anxiety, the blue line shows a pretty dramatic decrease in anxiety, where the control group stayed essentially the same. The depression, symptoms of depression, the control groups went up a little bit, about 2 points, where the rehab group actually came down in their symptoms of depression. And same with anxiety. Controls increased just a little bit over time, where the treatment group went up. Or sorry, where the treatment group went down, pardon me. However, if you see up in the upper table, our standard deviations, which is the variation in the data, were really, really big. So we couldn't find statistical differences between the two groups. And so we wanted to better understand, well, why is there so much variation between how each patient responded? Especially since, in the very beginning, we didn't really see that much variation. And this is also so we wanted to investigate the variation. And as I said before, this is just another way to depict that, is that we saw the controls were very straight and the treatment group in the maroon had nice decreases. But you can see from the bars on this graph, the large variation. So that's just what I was referring to before. Let's see if it's going to disappear for me. There we go. There's my animation. So we wanted to look at the variation. And what we found is we compared, well, was it something to do between the group and the having group format and having the one-on-one format? And so what you can see here is in the hashed area, that was the one-on-one format, where it was just one patient working with one therapist or exercise physiologist, versus group format, we had multiple patients joining on the session. And what you can see here is this is all just within the treatment group. So these are not any control patients. This is just with the patients who did the rehab. You can see that those who were in the one-on-one format stayed quite flat, or actually had, maybe a few of them had just a little bit of increase, versus the group format for depression and anxiety. You saw a really impressive decrease in their symptoms of depression and anxiety. So we said, okay, maybe some of our variation was that transition from doing one-on-one to when we got more patients enrolled in the program and we were able to administer group therapy, why we saw kind of a big change in their symptoms because of those two different types of format, with group therapy appearing to have more of an influence. And then we also noticed, and you see these yellow circles here, that it also seems like patients with more symptoms saw the biggest improvement. So it also seemed like, okay, if you were coming into the program with very low scores, you didn't really see a big change in your score. But if you were coming into the program with higher scores in depression or more anxiety, more depression, then you saw a greater change, which makes a lot of sense because if you're really not depressed or anxious, then there's really nowhere to go from that. We all have a little bit of depression and anxiety. That's perfectly normal. Then we wanted to better understand fear as well, and that's that anxiety with exercise. And again, what you can see here is the blue line is the group exercise, and the maroon line was one-on-one. Well, there's basically no impact at all. So we said, okay, it doesn't look like modality had any impact on the anxiety associated with just exercise, like just concerns with exercise. So what we did is we did something called post hoc, which means after the fact, we looked at correlations. What variables had the strongest relationship with a change in your fear with exercise? Because we had some patients with some pretty big differences, who actually saw a really big decline in their anxiety around exercise. And what we discovered was actually the patient's pulmonary artery pressure on their last right heart cath had the strongest relationship with the amount of change with anxiety around exercise from the first point that they came in to the second time, to that 3 month later test. And so what we discovered is actually it didn't really matter if you were a control or a treatment group, like whether you got rehab or not. If your pulmonary artery pressures are really high on your last right heart cath, then doing repeated stress tests, essentially doing that CPET, repeated CPET, really helped to reduce the patient's concerns around exercise, some of their fear around exercise. And actually, only two patients saw like really dramatic increases in their fear around exercise, and which we were like, well, that's really weird. Let's try to better understand that, especially in such a small group that can really make a difference. And what we discovered is in those two patients, which the blue is control and the maroon is rehab. And so both one was a control and one was rehab. So it didn't seem to relate to what group you were in, that in those two patients, both of them had actually had a lapse in their insurance coverage. They had a change in their insurance, and their insurance was no longer covering their pH meds. And so, for a period of time in there, they had to come off their pH meds to then, while they were getting new insurance, getting things worked out, and then they were on their medications again. And so, of course, they were very anxious when they came back for their repeat visit because they'd been off their meds for a period of time and were very afraid of how their exercise test was going to go, how their heart was doing, which makes a lot of sense. So we were able to really discover a lot about what kind of contributes to fear around exercise, what doesn't contribute to fear around exercise, and then the patient populations that seem to improve the most from doing rehab, from a mental health standpoint, from depression and anxiety standpoint. So, our take home messages for how this really impacts patients and the care of patients is we discovered that PCTR, which is pediatric cardiac tele-rehab, significantly improved exercise endurance. So we saw really nice gains in those clinical exercise outcome measures, which is very important for insurance coverage. So we can show insurance companies, yep, this program really helps people using the most stringent protocol that's out there, which is a randomized control trial. So that's really important for patient care. So if a doctor wants to get this covered for insurance, they can reference this work and help to advocate for that. We also discovered that group exercise appears to have the greatest influence on symptoms of anxiety and depression, more so than individual exercise. So, for patients who are suffering with those symptoms, a group exercise program may be more beneficial for them from a mental health standpoint than individual sessions. And we also discovered that there was a huge amount of variability within a patient's anxiety or fear surrounding exercise. And although there appears to be some impact from doing rehab with that, it wasn't as much as we hoped. We didn't see those big changes because it appeared to correspond more so with how high your pulmonary artery pressure was at your last cath. And then that, again, that repeated CPET seemed to have a really strong influence on those scores, more so than even doing rehab. So, future directions of this work, we're going to offer both exercise classes, both group and one-on-one exercise classes. So we definitely feel like there's a large benefit to the group exercise class that we weren't necessarily seeing in some of our outcomes with the one-on-one. But of course, for some patients, they may not be comfortable with groups, so you would want to be able to offer both options, but really important, particularly for those who are having some of those symptoms of depression or anxiety, to have access to a group class. We're going to continue to study the impact of the program on patients with more significant depression and anxiety. So we're going to use these results to then do kind of another trial where we actually really focus on patients with depression and anxiety. Like I said, those that are starting with a higher score, to see if we can further prove out that point with group exercise having a significant impact. We're going to continue to explore the impact of the program on fear. We're going to try to use a different questionnaire for some future research that is more specific to what we call kinesiophobia. So the exercise sensitivity questionnaire may be more generalized, and the kinesiophobia may be a better questionnaire. And then we're also going to start to look a little bit more about the psychology of repeated exercise testing, which I don't have a bullet here for that, but we're going to look at, kind of how repeated exercise testing impacts fear around exercise. And then lastly, we're going to transition away from strictly a research program, which is what we've been conducting for the past 4 years. And we've already started doing this to a clinical program where we can allow doctors to prescribe the program for their patients, and they don't have to be part of research, or they don't have to be, randomized to a control group, that anyone can come in and whose doctor thinks they could benefit to be able to perform the program and work with the program. So now we are so lucky today to actually have four patients who were part of our program to join us on our panel, where we can have an open discussion with them and their experiences so you can all hear their feedback on how they felt the program was for them and the impact it had on their lives. So I'm going to stop sharing my screen. Um, so I'd like to I'm going to introduce each individual and then they can go ahead and come off mute and be able to tell us a little bit about themselves. And then we have some questions that we can ask them, Dr. Fremed and I. Oh, actually, Dr. Fremed, was there anything that you wanted to add on before I move into introducing our panel?
Yeah, thank you. Hey, everyone. I'm Mike Fremed. I'm a general cardiologist and the medical director for this program. Thrilled that you're joining us today, and I'm thrilled that we're about to get to our patients that have been joining us in this to tell their stories. One thing, just in response, one of the questions that just came up in the Q&A is what did we do, or how did we assess patients either baseline oxygen saturations, oxygen use, and though we do track that, we check that when our patients come for exercise tests, we see changes with exercise in the oxygen levels. We didn't specifically track oxygen use, supplemental oxygen. I think, to my memory, no one in the study was consistently on supplemental oxygen, maybe some intermittently if they were sick or needed it. But it does bring up an important broader point that I wanted to make from the medical standpoint, or even just from a mechanical standpoint, doing an exercise program like this virtually at home with patients with a condition like pulmonary hypertension. It does present some unique challenges. One of which, besides for the initial fear of providers saying, how can you do this? Pulmonary hypertension is such a high-risk population. Are you sure this is safe to do at home? Which I think at this point, we've shown really that this can be done safely. There was a mechanical challenge that we encountered with patients who are on continuous infusions or Remodulin pumps in particular, that can provide a unique challenge during exercise, something we had to adjust for on the fly sometimes. But again, something that we were able to troubleshoot and to be done safely. For some people who are asking why we didn't track more clinically objective outcomes, like, let's say, right heart function, right, the squeeze of the right pumping chamber, other echocardiogram parameters, other objective parameters, and why we focus more on the exercise test and on the quality of life questionnaires. We did actually start out doing that, and we found it's a little bit difficult at this stage in the research to really tease out. We need a much bigger patient population to really tease out what is being impacted by the exercise itself, and what changes are being made by the frequent medications change often, things like respiratory illnesses, medication changes. All of that can make a big difference in those parameters. And so we haven't quite figured out how to directly assess that, the impact of our exercise program with what we have so far, but it's something we hope to do in the future.
Awesome. Thank you so much, Mike. And as those questions keep coming in, Mike and I will continue to answer them, and Mike can interrupt us to be able to pop in. So I'm going to start with Charlotte just because you're next to me on the screen. Charlotte, if you want to come off mute and you can introduce yourself to the listeners.
Hello, I'm Charlotte McFarland. I am 14 years old and I am from Lake George, New York.
Thank you, Charlotte. That's great. Isabella.
Hi, I'm Isabella Ramirez Janau. I am 18 years old and I'm from Nutley, New Jersey.
Thanks, Izzy. Charity.
Hello, my name is Charity Eliana Frempong, and I'm from Harlem, New York.
Hi, Charity. Thank you. And Alan.
Hello, my name is Alan Faust. I am 18 and I am from Pine Bush, New York.
Awesome. Thank you, Alan. So we're going to popcorn some questions around to you all, Dr. Fremed and I. So I'm going to start and then Dr. Fremed will take the next one. So Charlotte, this question is for you. Were you nervous at all to try the exercise program? And if yes, what helped you be brave? And if no, why not?
No, I was not really that nervous when starting the exercise program because from my previous visits to New York, I already knew a lot of the people who'd be like working with me, and so it was a pretty pleasant experience getting into that.
Awesome. So having a familiarity with the group made it not so nerve-wracking since you knew us all and you knew that we had exercised with you so many times before in person.
Yeah, pretty much.
Awesome. All right, Mike, do you have a question for maybe for Alan?
Alan, so we mentioned during our talk that we had switched at one point from doing this one-on-one to group sessions. You were part of our group that had that one-on-one experience. If you had the opportunity to do this again in the group format, would you choose that as an option? Do you think you missed out, or would have enjoyed the group setting, or did you like the one-on-one? And is that something you'd like to do if you were to do this type of program again? Alan, I think you're still muted.
Yeah, sorry. So if I had the chance to do it again, since I did do it one-on-one for the first time, I would like to do it in a group session this time around. I feel like it would be a lot better for me.
Awesome. Thank you so much, Alan. That's really good to know. Because that's always been a question is that some people are like, oh, like would people feel weird exercising with other individuals? So really good to know that. It's like everyone actually really seemed to enjoy the group format. My next
Yeah,
question is going to
I
be
will. I
for,
will
oh, sorry.
before. Sorry, Dr. Liam. Before we move on, I will add on that point, and I think the rest of you, most of you, were largely in the group settings, and we meet periodically before, middle, and after. And I know a lot of you guys are very nervous about the group format before you start the program. But in our experience from talking to all of you guys, by the end, most of you, if not all of you, were very happy to have had that opportunity to do it in the group.
That's great to know. Thanks, Mike. Izzy, question for you. Did you feel any differences in your strength or fitness after doing the program?
I feel like I really did. At first, obviously, since we weren't doing any high intensity workouts, I wasn't really seeing that much of a difference. But the more we went on, the more like the easier it was to like go up the stairs or like lift up not really heavy things, just like lift up things because I don't really have any arm strength. But like we were doing a lot of arm exercises and we were just doing a lot of exercises. So I feel like it definitely did help me, I guess, increase my stamina and my strength. And yeah, I definitely saw changes in that and also in like my body. I was like, oh my gosh, I have muscles now. So
That's great. Love it. Um, yeah, and a lot of times patients with pulmonary hypertension are actually told not to lift any weights with their upper body because people are concerned with increasing pulmonary artery pressures. So I think upper body weakness probably is something that is felt among a lot of patients. So I'm really glad that the group actually did a bunch of upper body. So you guys now feel comfortable that it's not that you can't lift anything with your upper body, but like what is a safe amount to lift with your upper body? Thanks, Izzy, so much for that. Mike, do you want to go to Charity?
Sure. Charity, tell us what were you thinking? What was going through your head when you first started in the group sessions? What was it like for you to get to meet all the other kids like you who have pulmonary hypertension while doing exercise together?
So I felt at first I was anxious, probably even nervous because I didn't know what to expect out of this program. But to see all of the other kids and adults that have my same condition and them being in the program to better their situation and their health, it was like surreal. It made me feel comfortable. It was fun. And I saw a big difference in my strength and health after that.
Awesome.
Excellent. Thank you.
Charlotte, what was your favorite part of participating in the program?
I really enjoyed all the exercises that had been chosen, like the bike and like all the weights and the exercises with the band. I hadn't really done much exercising before getting into the program, so that was a nice change of pace for me.
I'm going to piggyback that question. Charlotte, do you think it helped you feel more comfortable exercising or didn't really make a difference?
I definitely do. Because I was diagnosed when I was very young, I never really got to do much exercising in general, so that definitely helped me start getting back into being more active.
Great. Thank you, Charlotte.
All
Mike.
right, Alan. Alan, so for all of our audience members, so one thing that I think is really special about our program, because this is virtual, we ship all the equipment to the homes, and actually our participants so far get to keep the equipment at the end. Alan, do you still have that equipment, one, and if you do still have it, do you still use it? And are you still exercising on your own, even though you've completed the formal portion of the program?
Yes, I still have the equipment to this day, and I still do use the bike to this day. And along with it, have started to go to the gym a little bit myself.
Amazing.
Yeah,
That's
Alan, you
fantastic.
told us the other, oh, sorry, Mike. I was going to say, Alan told us the other day that he's now working at the YMCA, so he gets a free gym membership to be able to work out at the Y, which made me so happy.
I love to hear that. Excellent.
Good job, Alan. Um, So, Izzy, you told us a lot about how you felt like increases in your upper body strength and your stamina walking upstairs. What do you feel like changed the most within you with the program? If you had to choose something, was it more physical? Was it more mental? Was it more social? Is there anything that you felt like had like a very dramatic change?
Honestly, I think that my mentality around exercising really changed. Like I used to hate exercising or exercise in general. I used to find it like annoyingly hard. Um and boring and kind of funny because like I would go to the gym with my dad just to like hang out with him, and like all you hear is like grunts and like heavy breathing, and it's like what is going on. um but I don't know, after we were all like exercising together, I still kind of find it funny, but it's it's not as hard. And like I know now that it doesn't always have to be like, oh, you have to lift in 100-pound weight. Like I could still make a difference in my body and my stamina and my strength with just lifting 5-pound weights like repeatedly. And yeah, and I still use the bike, and um I still use the other equipment, and I still like work out sometimes because I don't know, I just like it now. I didn't like it at all before, but now I do.
I'm going to piggyback off that question with one more too. If we gave you all the equipment for the program, if we hadn't given you the equipment, do you think you would be able to still continue exercising when the program's done?
Um, I feel like I probably would have gotten my own equipment. I don't know. It's very hard to get me motivated. So I don't know if I would be as motivated because like the reason why I still work out is because I like see the equipment, like I see my bike in my room and I see the weights and the bands, but I feel like if I didn't like automatically see those things, I probably wouldn't work out as much. I'd probably still do it because like this program got me into the routine of it, but I don't know if I would. I don't know.
That's good to know. Well, I think that's really important because that's one thing we want to advocate for patients and for, payers out there is that like giving patients the equipment is I think super important. So important. So getting your feedback on it, I think really helps too.
Yeah.
Mike.
Yeah, and I would say to add on even further for background for everyone watching, this virtual platform, although there are there are centers that do it, doing this exclusively virtual is somewhat novel, and so showing that sending the equipment out, even though it costs a little bit more upfront, I think as we've been hearing, is really having it in your home, taking the burden away of having to travel. So I think my video cut out. Travel to the center, having that constant reminder, like Isabella just told us, that it's in your home makes is really a unique and valuable aspect of the program that makes it so effective. I want to pivot now to Charity, and similar question for you. Are you still exercising after finishing the program? But not only that, did doing the program lead you to find other activities that maybe you were either too nervous to try before or didn't even think that you were interested in before? What are you up to now?
Well, now I do take a lot of walks and I started the treadmill, which is very nice. That's my favorite thing to do. And I feel like at first I didn't know if I would like it or not, but as I kept going, I was like, this is like really nice. I want to keep doing this. And I started doing treadmills, more of the bike, and even like breathing exercises and things like that. Any kind of like physical therapy for myself that I just kept doing. And I want to continue doing it and try new things, especially.
Good for you.
Thanks, Charity. That's
Thank
awesome to
you.
hear. All right, so we have one more question for each of you. So for Charlotte, how did the team work with you if something was hard or if something hurt when you were exercising? Like, was there ever a time that something like hurt or you were like, I can't do this? And then what did the team do to help you through that?
Nothing ever really hurt, but some hard experience was when, like, if I was ever, like, really out of breath, the team gave me an opportunity to just take a moment to catch up, and then I would just keep exercising. And sometimes if my doctor said I shouldn't do a specific exercise, they would give me a different exercise to do in place of that. So,
Awesome.
Thanks.
Charlotte, can
And
you
Charlotte,
remind
I'm
me?
glad
Oh, sorry, Mike, you go.
I'm glad you mentioned that. One, doctors telling you not to do certain exercises, and two, the adjustments that were made in the session. We just got a question in the chat that I wanna just bump to the to answer live. Is were the group class workouts individualized, or was everybody doing the same sets, reps, and mode of exercise? And while for the most part, everyone was doing the same types of, generally the same types of exercise, but as Charlotte told us, we really rely on those exercise prescriptions and the individual histories. You know, that each patient is treated individually. So if there's physical limitations, either weakness on one side, muscle injuries, something's not feeling right, or you know, just we take all that into account. And our exercise physiologist, we have Reskin on the Zoom on the call right now, and Quentin are very good at adapting during the exercise session to really try to allow them to continue the session. But we always have, you know, from the medical side, I'm always on call for issues. So if there's concerns that it's not safe, then they'll stop the session and we'll pick it up another time. But most of the times those things can be modified. And so slightly different within generally the same categories.
Yeah, I mean, since we do have Ruskin on, Ruskin, are you able to give any input to how you modified exercises while they were all working out at the same time for patients?
Hey everyone. I don't know if you can hear me okay.
Ken.
Awesome. Generally, I really like to come in prepared. I also know a lot of body weight exercises. So instead of utilizing more weights, we can definitely transition to those. So those are just some of the techniques that I do with the patients that we have.
Thanks, Ruskin.
Of course.
Um,
Yeah, and then beyond that, we encourage, we really enforce the recommended heart rate zones, and we keep everybody in their specific moderate or below zone.
Yeah, I mean, this team, they're a pretty phenomenal team of individuals, and they're all really well experienced with working with patients with pulmonary hypertension. As Charlotte mentioned, our clinical team has the patients come to the lab every 3 months for a 6-minute walk test or a 6-minute walk and CPET. So they know these kids really, really well going into the program. And I think that probably helps with knowing how to adjust for each individual child. But that being said, it is not easy. And they were able to kind of juggle a lot going on at once on the Zoom calls remarkably well. Um, Mike, do you want to ask Alan the next question?
Yeah. So Alan, I think you alluded to this I think you told us you're trying new things, but did you find that you were more comfortable doing exercise, that you're more comfortable trying new activities, trying new things, or pushing yourself a little bit harder after the program compared to before?
I think so, yes. Before the program started, I feel that I was very not wanting to try a lot of new exercises and stuff. But now that I've done it and I've done all of these exercises, I feel that I want to try more and more.
Great. And do you think there was anything specific about your participation or the types of things you did in the program that allowed you to branch out like that, or that allowed you to have that extra comfort?
I think just the program in general helped me.
Great.
Awesome. Izzy, you were in a group that actually had a pretty big gap in age, where I think we had some kids that were like 9 and 10, and then some kids obviously going up to like 18, 19. Um, was it weird to have such a big age range and all in one session at once? Was it fun? Like, kind of how did that feel?
It was honestly really fun. It was weird at first. I think when I first started, like the first session, I was the oldest kid there. And it was like really cute because like I saw these like little faces and I was like, oh, they're so cute. But um, yeah, it was really fun. We all kind of became like a little family because we were always like together. It was like the same group every single time, for the most part. Like some people would join. And it was fun and we would just have like silly little conversations about our stuffed animals or like school or like anything. It was nice.
That's so awesome to hear. Yeah, when you're talking about it, it kind of reminds me how in elementary school they'll have like the fifth or sixth graders be book buddies for like the first or second or kindergartners. It was almost like you were an exercise buddy, where you would like come in
Yeah.
and like exercise with these younger kids, and then they could really look up to you. And like, you're very, very good with younger kids, which I think helped a lot.
Thank you.
But that's what it kind of reminded me of. So that's good that it sounds like you kind of had a similar sentiment.
Yeah, it was
Yeah,
really nice. It was fun. Sorry.
my kids are on dance teams, and they all have their big buddies, and yeah, they all look up to the older dancers. So in a way, you're inspiring the younger kids in the group. It will bring me back as a junior instructor.
Right?
Oh, that'd be fun. Yeah.
Alrighty. Mike, do you have a question for Charity?
Yeah, Charity. In our final moments here, tell us a little bit about how doing the program has changed how you think about exercise, or changed not even beyond exercise. How has it changed how you think about new experiences generally? Uh, what's been going on since you finished?
So since I finished, it completely changed my view on exercise, especially since having all the other patients here, and it was just like very comforting, and it made the whole program so much more comfortable, fun, and very encouraging to see that there's people out there just like me wanting to get their quality of life back, and made me feel like exercising was something really good to do. And I just I feel like exercising is a big part of my life now, and I'm willing to do it like forever.
Yay! Thank you so much, guys, for all of your responses. And we have a whole bunch of questions coming in through the chat as well. So maybe I'll go, I might need some help with this to what some of the questions for the panelists have been.
Yes, there have been a couple of questions. I see that some have been answered directly, but there are some questions if you click on the Q&A toolbar, but then also in the chat. We can start with the one in the chat was, how do we get to participate in the tele-rehab program? I know this is not something that is across the United States, so there may be some specific instructions for that.
Yeah, so I mean, if you're in the tri-state area, New York, New Jersey, Connecticut, obviously you can talk to your doctor about getting in touch with us. Your doctor, as we said, we're moving it from a research program to a clinical program, so your doctor can actually prescribe it, and we can actually work with you, right now we're just working with children, so like under 22. But I know Columbia and New York Presbyterian Hospital is also trying to get a virtual program underway for the adult side as well. For outside the New York City area, we really want to be able to implement this program across the country in other PH centers. And so I'm definitely working towards that with Dr. Fremed, and we're working on some NIH funding mechanisms to be able to potentially do something called an implementation grant, which is to say, hey, we successfully did this at our center. Now we want to be able to take this and set it up at other centers and help other centers be able to set up this program at their center. So teach them like, how do you do the billing? How do you, work with the different types of patients, all that jazz. And thanks to the support from the PHA and the support from this grant, that's kind of the next step that we can take this so that if you're not living in New York, New Jersey, or Connecticut, you still have access to a program like this.
Yeah, and I will add that as many of you on this session are probably very acutely aware, the number of specialized pulmonary hypertension centers around the country are not all that many, and some of you may have to travel far distances to get to your place. At the same time, as a virtual program, we're a little bit limited by laws regarding medical licensing and who we can have video visits with. And so we're restricted at the moment to tri-state area, but yes, we in the future would love to be working with other centers to try to train people up, implement this other places so that there's access to this everywhere. I see one question, will the program be available to patients older than 25? One day, yes, and that may be an option at adult centers. We're a pediatric center, pediatric cardiology trained and licensed, and so and certified. And so right now we restrict to the younger populations, partially because that's what we have experience with, partially because that's the population that we work with. But yes, we would love to expand this work with our adult pulmonary hypertension providers and our adult cardiologists colleagues to try to expand this to all patients at some point.
Let's see here. I guess this is just general. You may have answered this one. This is for the panelists, Alan, Charity, Charlotte, and Isabella, about continuing the exercise outside of the program. I feel like you answered that one already. Let's see what else is here. Everyone, just positive comments for our patient panelists. You have done so well on this call. Everyone is very supportive of the work that you've done so far. So thank you for that.
Yep. I do want to take the opportunity because I see that she's on the call and beaming with pride about her patients, but a very special thank you to Dr. Usha Krishnan, the director of our Pulmonary Hypertension Center, and the primary cardiologist for our wonderful panelists today. We could not run a program like this without Dr. Krishnan and her team to help keep everybody safe, identifying patients for us, and just really managing very, very complicated, wonderful, but very complicated patients, and making sure by working with us and us working with Dr. Krishnan and her team that we can continue to provide it safely.
Thank you.
Absolutely.
Let's see. I'm not seeing any other questions you may not have answered. Someone said we use an RPD guide to guide intensity also in their pulm rehab program. I don't know if there's very much expansion on that.
We do, yeah, and we do that as well. So during the exercise test, we continue to ask the RPE is the rating of perceived exertion. So it's like, how hard are you working, 0 to 10, or depending on what scale they use. And so we do that as well. But Particularly, sometimes people, if they haven't been exercising a lot, it's hard for them to really gauge what 10 is. And so sometimes it's a little bit tricky. So we do take into consideration the RPE, but we look at the RPE in conjunction with their physiological metrics, like when they're building up lactic acid, if they had any changes in their ECG, if they start to get hypoxic, all those metrics we use to be able to come up with our personalized exercise prescription.
Thank you. And I just saw another one. Any recommendations? I don't know if I'm saying this correctly. SpO2 device for real-time tracking. The finger sensor is awkward and cumbersome.
Finger sensors obviously cheap and easy. I don't know, Mike, do you have, I don't know if other devices, I mean, I guess the Apple Watch technically can pick up on SpO2, but I don't know how accurate, if it's very good or not.
Yeah, the most accurate are the medical grade devices. There are apps on the iPhones where you can put your finger on the light sensor, or the ones that come with an attachment that give you a an oxygen saturation. I'll be honest, I don't know how reliable they are or if they've been tested. But when it when it really matters clinically, I think you probably want something that's been validated.
Yeah, and that's where those RPEs come in as well, is that if when you're getting your exercise testing or your 6 minute walk testing, if this team working with you can help you gauge kind of what your shortness of breath was at different levels of oxygen desaturation, then you can just start to get in tune with your body too, which sometimes helps to be able to say like, oh, I'm noticing my breathing kicking up to, let's say, like a 4. And that's usually when my saturation's like 85%. So I'm going to back it down at that point. This is also where hypoxemia is really complicated in patients with pulmonary hypertension because one patient may feel fine at 75% because of how their heart works, and another patient may feel awful at like 88%. So that's where like you really have to gauge within each person how, what is a safe level for them and what isn't, because just using a market threshold for everyone, you sometimes will have patients exercising way too easy, and sometimes you'll have patients exercising way too hard.
I did put a final call out for any final questions for our panelists before we wrap up for the day. While we are waiting for our final questions, any final remarks from either our patient panelists or from you, Aimee and Michael, to our audience, to the attendees listening in?
I think my final comments are just a huge thank you to the patients and, as Mike said, Dr. Krishnan for coming on today, for her support of our program and for her putting faith in our abilities to be able to carry this work out, and the PHA putting faith in our abilities to carry this work out and supporting this really, really important project that I think will hopefully impact other centers and their confidence in exercising with patients with pulmonary hypertension. And all these really brave kids who, as you heard, they all were like a little nervous, some more than others, starting the exercise program. But they put their faith in us every day to keep them safe and to be the best that we can be to help them through their journey, which is a really tough one. This is a really hard disease. And so we are incredibly grateful for these remarkable young people. I hope I get to stay in their lives for a very long time, to be able to watch them grow. It makes me like almost cry thinking about them as like really little kids. Like we start working with them when they're 5 years old sometimes, especially the, children on this call. I think I've known all of them since they were really little. And so like when Isabel was small enough, I could actually carry her. And now she's like taller than I am. And so it's just such a privilege to get to experience their journey with them and try to give them all the tools that we can for them to be able to battle this disease.
Yep, I second all of that. Thank you guys so much. You were excellent. You are amazing.
Yes, I agree. Planning out this webinar and talking to each of you individually, knowing you were nervous, but then you coming on here and just blowing it out of the ballpark. I think you did a wonderful job today, so you should pat yourselves on the back. Thank you for sharing your stories with us and your journey through this program. I would like to thank again Ruskin, Aimee, Michael for pulling this together and sharing more information on your research. As I mentioned in the chat, PHA, as we celebrate 35 years, we, along with our donors, have donated or contributed over $10 million and invested into research, and we hope to continue that. We do have research programs opening up for the 2026 year, so hopefully you can connect and apply for those grants. One final thank you to our sponsor, Johnson & Johnson and Merck, for their support of our programming. And thank you all for joining us today on this webinar. We appreciate you, and we hope to see you on the next one. Everyone
Thanks.
have a
I think
great
Charlotte's
day.
got her hand up. Maybe she has one final
Oh,
comment.
Charlotte, you have something to say before we go?
Yeah, I just want to say thank you to everyone who's been working on the exercise program because it really helped me get back into exercising. And also thank you to Dr. Krishnan, who's really helped me all these years. And one last thing, just like if there's any other kids listening in or just in general, to make sure to always tell anyone if you're having any symptoms whatsoever. It's really important. I think that's it.
Thank you, Charlotte.
Thank you,
And
Charlotte. That
thank
was
you.
great. Thank you so much. And thank you all for being here. Y'all are very inspiring, just seeing some of the chat messages that are coming in. Like I mentioned before, we will have this webinar posted within the month for review, but hopefully we'll see you soon on other programming here at PHA. Thank you for joining us. Y'all have a great rest of your day. Bye-bye.